and from the other side I pass again through the cartilage and then through the skin. And like this I am pretty sure that the graft will be exactly where I think should be. It's fast and easy. Of course, one can just anchor the graft directly on the domes, on the lower lateral, but this is a nice way to do that. With the closed technique, we rarely need to use bulky grafts. With this approach, they are useful mainly in ethnic and secondary cases, when a strong tip support is necessary. So in those cases, if I don't have enough septum, I use the concha again, and I just cut two slices, and I just put them together on the concave face. I just suture them together, and then I insert this strut in the pocket, and it is quite strong, exactly as a good piece of quadrangular cartilage. You see, this is the pocket, and I insert it in the right place, and then I anchor it to the medial crura, and if I need more projection, I make an interdomal suture over the tip of this strut thread, and this gives me good possibilities to take care of a very broad tip without good support. And for example, you can solve this kind of problems with very ptotic tip, because I can just really support the tip, and you see even when he is smiling, the tip is still in its place. Or this guy, the same problem with a very hanging tip, which can be very well supported by this kind of good and strong struts. Resorting to an open technique means instead always to strongly support the nasal tip, because otherwise you will end up with a kind of supratip deformity with the polyp. So we need to insert a lot of grafts in any case. The majority of the most common procedures used to sculpture the nasal tip with the open technique can be easily performed through the closed approach. Of course, the interdomal sutures, I don't perform any inter or intra cartilaginous incision, because just with the marginal one, you will deliver the cartilaginous arch without any difficulty, thanks to the excess mucosa you have at the area of the valve. So you make your delivery, you sculpture the cartilaginous arch, and then you pass to be symmetric the suture from inside to outside in the right dome, then from outside to inside. Then you take your suture from the left nostril, and you make the same, but passing from inside to outside, and then from outside to inside. Then you take the two domes in the right nostril, and you make the knot. And like this, you are very sure to be symmetric, to be on the midline. And you can solve problems like this when you don't need a huge sculpturing of the tip, but just a remodeling